Hello guys, welcome back to my YouTube channel. In this video, we will learn about convex concave rule. What is this rule and why it is so important for every physiotherapist? Okay, let us see the convex concave rule. The rule is described as follows, and it's a very simple rule guys, and there is no need to you have to mug up and all these things. It's a very simple rule. If you know the anatomy, if you know the shapes of the articular surfaces, then it will be you will rock in all the mobilization techniques and all these things. Okay, now let us see the rule. Okay, first I will tell about the convex and the concave surfaces, articular surfaces. For example, if you take the glenohumeral joint, the glenoid cavity is a concave articular surface and the humeral head is a convex articular surface. And if you take the hip joint, acetabulum is concave and the femur head is a convex. And if you take the knee joint, the tibial condyles are concave and the femoral condyles are convex. Okay, like that. In a human body, there are certain joints which are articular surfaces which are convex and concave. Okay, there are other joints which does not depicts convex concave articular shapes. Okay, now the rule is as follows, and it is very simple. It tells that if a convex articular surface of a joint is moving on a relatively fixed concave articular surface, then the glide or the slide will be opposite to that of the angular motion. As I said in my previous videos, what are angular motions? Angular motions are nothing but the classical or the physiological movements, okay, which are flexion, extension, abduction, adduction, medial rotation, lateral rotation. Okay, these are the angular motions. Angular motions are best described through the study which describes these motions is known as osteokinematics, as we have studied in the previous videos. Okay, now if a convex moves on a relatively fixed concave, then the glide or slide will be opposite. Now I'll give an example. Let us take an example of a knee joint. If you are doing a squatting exercise, okay, in squatting exercise, the distal end of the foot is relatively fixed on the ground. So the tibial segment is fixed and the femoral segment moves. If you go down, it moves into angular motion flexion, and if you come up, it's angular motion knee extension. Okay, now let us take, if you go in a flexion phase, a squatting exercise consists of flexion phase, that is going down, and the extension phase, that's coming up. Okay, now if you take a flexion phase that you're going down, on a convex articular surface is moving, that's a femoral condyles on a relatively fixed concave articular surface of the tibial condyles. Okay, when the convex femoral condyles are moving into a flexion angular motion, you're doing in flexion when you're squatting, the angular motion is in that direction, but the glide or slide will be anterior to that of the angular motion. Okay, that is opposite. When you come up, again it is opposite. When you are coming up, the angular motion is extension. Okay, the glide will be posterior. Okay, this is when the convex articular surface moves. Okay, now let us see. This is another example of a glenohumeral joint. For example, if you are doing a shoulder glenohumeral joint abduction, okay, the angular motion is in this direction. Okay, the glide will be in the opposite direction. The angular motion is superior. Simply remember this. The angular motion is superior and the glide will be inferior. Okay, in this, the concave glenoid cavity is fixed and the convex humeral head is moving. Now let us see what happens if the concave articular surface moves on a relatively fixed convex articular surface. If this happens, the glide will be in the same direction. Remember this, guys. This is the the major difference between with respect to that, when the what happens when the convex moves, what happens when the concave moves, which segment is fixed, which segment is not fixed. Okay, if a concave moves and the convex fixed, the glide or slide will be in the same direction. I'll give an example again of the knee joint. Again, you take the example of a squatting exercise. If you are doing, for example, not the squatting exercise, if you are doing, for example, open kinetic chain knee extension exercise, on a high sitting open kinematic chain knee extension exercise, in this the femoral segment is fixed and the tibial segment is free to move, which is not fixed on the ground, as you have seen in squatting exercise. Okay, now when the tibia moves from flexion to extension, the tibial condyles also move in that direction. That is an extension, that is angular motion, and the glide or slide will be in that direction only. Okay, when it is flexes, when the tibial condyles the tibia comes into flexion, the glide or slide will be in that direction or posterior. When you do extension, glide or slide will be anterior. When you do flexion, the glide or slide will be posterior. Okay, this is opposite to that of a squatting exercise, which I have already explained. Okay, now this is another example. Okay, now we'll see the picture B. The convex, this the inferior bone, which is convex shape, and the superior bone is a concave, having a concave articular surface, and this bone is angular movement is in this direction. For example, assume that it is as a flexion. Okay, so the slide will also be in that direction. And as I said in the previous videos of my arthrokinematic motion, the roll will also occur in the same direction as that of the angular motion, irrespective of the shape of the articular surface, whether the articular surface is convex or concave. So this picture is also depicting the same. So when the concave moves, simply remember, when the concave moves, the glide and the roll will be in the same direction. When the convex moves, the glide and the roll will be opposite. Glide will be in one direction, roll will be in another direction. Okay, this is the major difference, guys. If you know this, you are the best physio, sure, definitely. Okay, what is the importance of this role? As a physiotherapist, you should also know the importance. This is the viva question, guys. Why convex concave rule is so important? Okay, by understanding this rule, a physiotherapist can easily apply joint mobilizations as a therapeutic technique. This is very important, guys, to decrease the pain and increase range of motion of an affected joint. Guys, I will be discussing all the mobilizations, theory part and the mobilization techniques. I will be discussing in my upcoming videos. Okay, for time being, just remember, this rule helps in decreasing the pain and increasing the range of motion, and the therapist can easily apply the joint mobilization techniques. Okay, thank you, guys.